Hello, my name is Pam Hawks, and this is my presentation on meditation for our patient Bill. So these are some physiological symptoms that may be seen with things that Bill's presenting with: increased heart rate, increased blood pressure, chest pain, dizziness, lightheaded, sweaty, and muscle tension. And these are some psychological symptoms that Bill actually did present with a few of these. He stated that he's in a constant state of worry and anxiousness. He's struggling with guilt or hopelessness. His mood is very anxious. He's complaining of periods of insomnia with difficulty falling asleep. He's complaining of fatigue and difficulty concentrating. Meditation may be a good option for Bill because Bill has already identified that he finds peace walking through his land and sitting by the lake, that he enjoys just walking through his property out in nature. Meditation requires consciously focusing on current internal and external experiences. Meditation also centers on improving focus and self-awareness while regulating breathing. Meditation can be done with your eyes open or closed, can be done sitting or standing, and while walking, so this would be a very good option for Bill. Meditation is a self-regulatory practice of the body and mind that can be performed in various ways and is also a non-pharmaceutical, low-cost tool. So educating Bill on how to meditate. First, locating a quiet place. Bill has already identified that he does enjoy sitting by the lake. He enjoys walking on his property out in the woods. He said that that is a place that he has found peace. We would encourage Bill to wear comfortable clothing and also encourage Bill to decide on the amount of time that he wants to spend meditating. Although 3 minutes has been shown to be effective, but consistency was shown to be the most important part for successful meditation. Also helping Bill to identify a comfortable position, lotus or half lotus, making sure that the body is balanced, sitting tall with straight posture, and this improves breathing techniques. Meditation can also be done while standing, lying down, or walking, which was previously mentioned, and this would give Bill the flexibility of deciding which way that he would like to meditate. His eyes can either be opened or closed, and once all of this is established, then he would begin his breathing techniques. So this is a little bit of a recap from the previous slide. So first, we would ask Bill to kind of set a timer, or just to gauge his time for that 3 minutes that he's allowed. The space needs to be free of distractions, which the lake would be perfect for this. He needs to sit comfortably. He can either have his eyes open or closed, and thoughts may come into his mind, and we would just encourage Bill to just acknowledge those thoughts and to refocus back on his breathing. Bill is going to observe his breathing, moving slowly in and out of his body. Just simply observe that. And then he's going to bring his mind back to his breathing. Whenever his mind wanders, then he can focus on that thought for a moment, then bring it back to breathing, always returning to the breath, letting go of the thoughts and the feelings that he has, and then continue his meditation for 3 minutes. There is studies that have shown that different forms of breathing will help a person either to relax or either to become more alert. If the inhales are longer and the exhales are shorter, the patient will feel more alert after the meditation process. If the inhales are shorter and the exhales are longer, the patient will feel more relaxed. And we'll go into this a little bit later. This is a lot to do with the way the brain responds to meditation. I have included 2 links. The first one is a YouTube link that's 5 minutes long, and this just goes over a short little meditation. The second one is a little bit longer. It's a 15-minute meditation for patience and resolve. This mindful.org has a lot of other meditation sessions on there that are free of charge. I would highly recommend maybe looking at the 5-minute one if you don't have a lot of time. So what are the benefits of meditation? So in a preliminary study of virtual reality guided meditation for veterans with stress and chronic pain was found that a lot of veterans did not know how to meditate, that they were becoming too distracted with the physical surroundings, their environment, and it was hard to focus. Also, a lot of veterans were saying that they didn't know how to do meditation. It was too difficult. So the use of virtual reality helped to eliminate those distractions and showed improvement with the use of meditation. The use of meditation showed that engagement in meditation practices lowered the levels of post-traumatic stress disorder. There was also a reduction from baseline with systolic and diastolic blood pressures. There was also a reduction in heart rate from pre to post intervention. And there was also a decrease in subjective report of pain and stress with the use of meditation with virtual reality. Other benefits of meditation that may be good to share with Bill is in a study, Meditation, Compassionate Love, and Mental Health in Later Life, it was shown that regular meditation increased activity in areas of the brain that were responsible for empathy and compassion. Regular meditation is associated with increased self-compassion, which is a predictor of greater psychological well-being. Also, positive emotion cultivated during meditations were still present a year follow-up, and then meditation activates regions of the brain that regulates emotions. And then practicing meditation demonstrated decreased depression and anxiety and overall improved mental health. So the benefits of meditation. Meditation actually makes changes in the brain, and this was seen through neuroimaging. It showed an increased activation of the insula. The next slide I'll show you, there is a diagram of where that is actually at in the brain. But that region of the brain, the insula, is involved in self-awareness, empathy, and interoception. It also, with meditation, showed a decrease in the amygdala activation and an increase in the anterior cingulate cortex, which is an area responsible for attention. The neural changes that occurred within the brain support present moment focus, leading to clinical benefits of meditation with a decrease in depression and anxiety. They were also seen a lot of neuroplastic or functional changes within the brain with meditation. So on this slide, this is a diagram of the brain, and this shows the areas of the brain that are affected when meditation is used. So as previously mentioned, the insula, the amygdala, and a lot of areas in the prefrontal cortex are involved with meditation. Tracking outcomes for Bill can be done with several different screening or assessment tools. One of these is the Beck Anxiety Inventory, which is also abbreviated as the BAI, which is a self-reported tool measuring anxiety. And below that is listed the scores to indicate low anxiety and concerning levels of anxiety. The second one is the Hamilton Anxiety Rating Scale, or called the HAM-A. This is the first rating scale that was developed to measure anxiety with 14 items. The scores on this are also indicated here, with scores lower than 17 as considered mild, and scores of 25 to 30 considered severe. Two other tools that can be used, and these are mainly dealing with post-traumatic stress disorder. One of these is the Severity of Post-Traumatic Stress Disorder or Stress Symptoms for Adults, National Stressful Event Survey, PTSD short scale, abbreviated NSESSS. This is a 9-item that measures the severity of post-traumatic stress disorder with patients 18 years and older. The scores on this range from 0 to 36, with higher scores indicating greater severity. Scores can be tracked and should be tracked at regular intervals as clinically indicated. If higher scores, then it requires further assessment. The other one is the Post-Traumatic Stress Disorder Checklist, PCL. There are 4 versions of this. There's the PCL-5, PTSD, that works on the new DSM-5 diagnoses. The PCL-C is for civilians, the PCL-M is for military, PCL-S is for non-military. Scores higher than 38 indicate probable PTSD in veterans. The PCL-5-PTSD can be used to assess changes in post-traumatic stress disorder, with a reduction of 5 points indicating a reduction in symptoms, and a reduction of 10 to 20 points indicates significant clinical change. So this slide just has a lot of resources available for meditation and breathing exercises. The first one is just a PDF or just a picture of box breathing. The second one has a lot of different breathing exercises. No one particular breathing exercise works for every patient. And the third one is different types of meditation or mindfulness available. That's also in a PDF file. The fourth one is a 2.5-hour podcast. Although that is very long, you can kind of skip through some parts of it. There are some parts that are more beneficial on meditation than others, but I found that very helpful. The last one was extremely helpful. So this is from the VA, and Bill is a veteran, so this may have a lot of information in it that may be very helpful in using with this patient. It's a 15-page PDF document. The last pages are extremely helpful. So they have a link to the VA office with audio recordings of meditation, and they also have PDF handouts that would be very helpful in using with Bill. And this is the end of my presentation. This is my reference slide. I know this was a long presentation. There was a lot of really good information in here that would be helpful in using with this patient. Thank you for watching, and thank you for your time.